Welcome to 2023. This year, we're kicking off our discussions with a topic that can be hard to talk about, but is vital. Every 68 seconds, someone is sexually assaulted in the United States, according to the Rape, Abuse, and Incest National Network. To help when these assaults take place in our community, Enloe has a staff of forensic registered nurses available 24/7. The purpose is to ensure that anyone who has been sexually assaulted or abused can access a forensic medical exam. Hi everyone, I'm Daniela Contreras. I'm here with Jacqueline Winters-Hall, a forensic nurse examiner and coordinator of Enloe's Sexual Assault Forensic Examination Program, to talk about Butte County's Sexual Assault Response Team. Thank you, Jacqueline, for being here again today.
I'm happy to be here.
So let's start off with, what is Butte County's Sexual Assault Response Team, or SART?
The Sexual Assault Response Team is a collaboration of private and public agencies that have come together to help solve the problem of sexual violence. It's comprised of, the hospitals and law enforcement, the district attorney's office, victim services bureau, advocacy groups, the colleges, public health is very involved, and the tribal nations, and others, Stonewall Alliance, everyone that's involved. The SART is the collaborative group. We meet bi-monthly, and at that time we can do case review and talk about what went well, areas that we can improve, and we also do a lot of legislative updates and scientific updates.
Oh, that's great. That's really good to know. And what's Enloe's role in SART? Because we have our own program, is that right? Like SAFE, it's
Yes.
called?
So our role in SART is we're one of the founding members of the Butte County SART, and I've served 2 terms as chair of SART. When the patients first come to us, we're one of the very first responders to the patients. And then, so our role is vital. Enloe's role on the SART is important.
Yeah, and it's very hard, but can you walk us through the process when a survivor seeks this help? Like, what is the process like?
So patients come to us a number of ways. They can come in on their own, brought in by friends or family, come in with advocacy, or of course accompanied by law enforcement. When they first come in, they're rapid triaged as soon as they declare that they're here after being sexually assaulted. They're rapid triaged so they don't have to spend a lot of time in the waiting room, hopefully. And then we're notified they're medically cleared to make sure that they don't have other emergent medical needs. And then the charge nurse notifies our social work team, and the social work team will go out and meet with the patient, and so that they can get an idea of what the patient needs and do a warm handoff with us. And the charge nurse activates the forensic nursing team and notifies us. We determine which forensic nurse is going to respond, and then the forensic nurse comes out and greets the patient.
Oh, wow. That is so nice that you guys do it in such a warm way.
Trauma-informed care is important for patients that have been sexually assaulted.
Very nice. And then, is law enforcement always involved?
No, they're not. Patients do not have to engage with law enforcement to receive a forensic medical exam. We do encourage them to, but it is absolutely not required to receive an exam and have their evidence collected and analyzed.
Well,
They can make that decision later.
Oh, great. So there's a little bit of pressure off.
Yes, absolutely.
That's good. And then, unfortunately, sexual assault is prevalent nationwide. Is that also true for small communities like Butte County?
Yes, it is. No community, no demographic is immune.
How can people access these services? Like, do you need to be referred? Do you just come by yourself?
Patients can just come in. There's no referral needed. They can come in. We are available 24/7. After a sexual assault, the sooner the better to receive a forensic medical exam for collection of evidence. We can do exams in some cases up to 10 days after an assault, but DNA rapidly degrades.
Oh, wow.
So the sooner the better. The best DNA is collected in the first 72 hours. And after that, the odds of identifying suspect DNA go down. However, there have been a few studies where 9 days out, so we set our limit at 10.
Right, so we encourage people to come as soon as they are able to.
That's correct.
And some people might be concerned that it could be expensive because medicine in general is expensive. Does this come at a cost for the survivors?
No, there is no cost for the survivor. Forensic medical exams cannot be billed to the patient. Law enforcement pays for the forensic medical exam. Okay. Now, if the patient has medical needs associated with the assault, they have insurance, we will bill the insurance, and then we help the patient connect with Victim Services Unit. And the patient connects with them, and then the district attorney's victim services unit will pick up the rest of the cost. Now, if a patient does not have insurance, that's okay. Then victim services unit will help them through the process.
That's great because that's very reassuring.
Yes.
So, Jacqueline, for those of us who don't know, what is a forensic nurse? How are they different from regular nurses, registered nurses?
So forensic nurses are all registered nurses. Mm-hmm. At Enloe Medical Center, our program is comprised of 8 forensic nurses. Wow. They are all emergency department trained nurses and critical care nurses. Those are their home units. Mm-hmm. And then they also receive additional training in forensic nursing, which starts off with an initial 40-hour training. That's just the basic training. Uh-huh. And then they come back and we do another 40 hours minimum of hands-on clinical training. And we meet every single month for 2 hours for continuing education and training. Oh, plus, wow. We go to conferences. Forensic nurses are the link between medicine and the criminal justice system.
Oh, wow.
So we have expertise and training in the criminal justice system, in the neurobiology of trauma, which is how the brain responds to trauma, so that we can appropriately take care of our patients and meet their needs where they are. We have education and expertise in injury identification and documentation, documenting every injury and wound, DNA collection, evidence collection, trace evidence, documenting appropriately so that it stands up in court, and chain of custody, forensic photography, and we provide expert medical testimony in court.
Wow, that is amazing because that's a lot of things.
It is.
And how important is it that small communities or rural communities have forensic nurse examiners?
It's vitally important that we provide these services close to home. Patients, when they're already traumatized, the last thing we want to do is send them away down to another community. It would be Sacramento for forensic exams. So Enloe has made a commitment to providing this service here in our community to take care of our patients close to home.
That is so important and so good to hear that we have those here. For someone who might be on the fence about seeking help, is there any advice that you could give them or any words that you would say to them to encourage them?
Yes, please come to the hospital. Even if you're unsure if an assault happened, we can help collect evidence so that perhaps there is DNA there. We also provide medical assistance. If the patient doesn't want to go through with a complete forensic medical exam and they just want to know that they're going to be okay, we provide medication to prevent diseases. And prevent pregnancy, and we can also do a medical assessment. Sometimes patients have been physically harmed and strangled as well, so we provide those services.
That's good. And Jacqueline, is there anything else that you would like to add that I didn't ask you?
Not really. I just want to encourage survivors to come to the hospital and talk to us and seek medical care. It's a very scary time. It's one of the worst experiences of their lives, but our patients are the bravest people that we have ever taken care of. And just to please come to us and we'll help them figure out what their next steps could be.
That's great. Thank you again for being here today, Jacqueline.
You're welcome.
And thank you all for watching. To learn more about Sexual Assault Response Team, visit enloe.org/emergency. If you enjoyed today's discussion, be sure to catch Enloe's podcast, Health Matters. We placed a link to it in the comments field. And some exciting news. The podcast and these Facebook Live discussions are merging. Starting next month, you'll be able to continue watching these discussions here on Facebook, but also listen to them wherever you get your podcasts. We'll continue to bring you the vital health information and clinical expertise you've come to expect. Goodbye for now, and we'll see you in February on Health Matters.